Alcohol sales ban by government, of course, was part of its efforts to flatten the curve and to bring down the numbers as far as the spread of coronavirus is concerned. Government argued that alcohol led people to reckless behavior that may have led to the spread of the virus and overwhelm hospitals. Let's discuss this further. Now I'm joined by Professor Prof Parry, who is the director of the Alcohol, Tobacco and Other Drug Research Unit at the South African Medical Research Council. Prof, good evening and thank you for your time tonight. Allowing the ban or the lift on the ban of alcohol, are we doing harm to our fight against COVID-19?
Well, I think there's multiple factors that have to be brought into account. I think if we were just to look at it from a public health point of view, then I think we would continue with the ban on alcohol. But as one of the previous callers said, the government's looking at the economy and things like that. So I think it might be the right thing to do, but I think there are other measures that we should be instituting at the same time as lifting it. And I think we're missing the opportunity. I mean, we're hearing a lot about what the industry is doing at the point of sales to make sure that people don't, come in crowds and limit the numbers coming in at certain times, making people hand sanitize, wear masks and that. But I think that if we were going to open it up, then I think there are other measures we should have also instituted, such as, for example, as also was said, we're trying to limit the burden on our healthcare system. And we know that we're seeing a lot of people come to our trauma units where the alcohol-related injuries. And I think we should do a number of things, such as, for example, right now we should be dropping the blood alcohol concentration for drivers to 0. That's something that was on the table in 2015. But I think it would be a good time to institute measures like that. I think we also need to look, if we're going to be making it open at this time, we need to have controls on the marketing of alcoholic beverages. It's not the time for the industry to be pushing sales. I know they're trying to build up their profits again, but this isn't what should be happening now. So I think we should be only having marketing of alcohol products at the point that people are purchasing the products. It should be taken out of television, radio, and newspapers. And I think we should also be looking at certain products which are particularly harmful. And we found that heavy drinking has been associated with the 1 liter containers of beer, and maybe we don't need to have those in our market at this time. But, I think the government is in a very difficult position. If we were just looking at public health, I think we would continue with the ban, and we would say, look, it's potentially harmful in terms of encouraging community transmission. Bringing alcohol into the home after people have been kept in their homes is potentially going to increase the risk of gender-based violence. And also we will certainly see some of our modeling done at the Medical Research Council has shown that we can expect probably about 5,000 additional admissions to trauma units at public secondary and tertiary hospitals around the country per week. Yeah. That's going to put some competition on beds and things like that.
So speaking of competition, if we are to measure the public health cost versus the tax revenue that we will derive from opening up that sector of the economy, is it worth it?
I mean, that's a very difficult question, because you're balancing two very different things. The government is getting tax revenue, and we certainly heard that Minister Tito Mboweni talked about the government losing about 1.5 billion rands in a 29-day period about a month ago. And certainly there are economic costs associated with alcohol abuse, but many of those are only derived in the longer term. So certainly we're not going to get the same benefit in terms of the economic benefits to the country by saving on the trauma beds. But it's a very difficult issue to deal with, and I think the government certainly has done well by banning it for phases 4 and 5, and we've got the benefits of the empty spaces in our trauma units. We probably have flattened the curve because people aren't going outside and drinking with their mates and things like that. But I think it's a very difficult decision that has to be a political decision. I mean, from a public health point of view, we can tell them what the costs are, but certainly someone has to make that decision, and it's a balancing, and the government's got to do it. But I think we could be doing better to limit the harms. As I said, we should be looking at things like better enforcement of public drinking in the next few weeks. I suspect it's going to be a bit chaotic over the next few days, people getting access to it. It's got to open up sometime. But we'll find out what's going to happen. It's a risk opening up again.
As far as, and I will come to talk about that risk actually. But first and foremost, what type of public health messaging should the government be communicating at this point? What advice should they be giving out?
Yeah, I think all along we could have done better. The government could have done better in informing the population, why it was making the decisions. We know, for example, that heavy drinking is associated with risks to the immune system, particularly, for example, TB, HIV, and even lung immunity. And that's one message that hasn't been got out. I think the government could have made it clearer that one of the reasons for controlling drinking was to try and control people from drinking socially with people outside of their households. The other one is to decrease. We've seen a reduction in gender-based violence, and I think we needed to tell people that alcohol has certainly played a role in that. The weekly death rates in South Africa and Israel are two countries which have actually seen a net reduction in deaths compared to what was usually expected at this time. In terms of going forward, I think we do need to we have a population in South Africa. Many people don't drink, but about 31 to 35% of the population do drink. And of those, it's been shown that about 59% engage in heavy episodic drinking. So we need to encourage people, if you are going to start drinking again, don't binge drink. Drink one drink, two drinks, but don't go beyond that. And be aware of the risks. If you're going to be drinking in a household with someone, you can also be putting yourself at risk of where interpersonal violence can happen with two people drinking and things get out of control. So we need to encourage moderation at this time and not to go crazy just because the taps are opening again. But I think we also can't just look at individual behavior. We need to look at corporate behavior and get the liquor industry to be responsible, to look at their marketing of alcoholic beverages. It's not the time to try and make up for profits. And we need to, there's talk about limiting the amounts of alcohol that people can purchase, but that hasn't really gone anywhere. And maybe we need to tell people that, 14 standard drinks per week is a sort of a maximum amount you should be drinking. And we don't hear that kind of messaging. We've just opened it up without much public messaging at this time. So it's good that you're sort of having a program like this to try and get some of those messages out.
Prof, I appreciate your time. Thanks for joining us tonight. That's Professor Charles Parry, who is the Director of the Alcohol, Tobacco and Other Drug Research Unit at the South African Medical Research Association.